Good morning. Recognizing that we have quorum, I'd like to call the Health and Human Services Committee to order. Mr. Clerk, please call the roll.
Gracia,
Mr. Clerk,
me,
we may want to turn your volume up just a tad.
the woman in Gracia. Is that better?
Present.
Alderwoman Tyus. Alderwoman Green.
Present.
Alderwoman Martin. Alderwoman Navarro.
Present.
Alderwoman Middlebrook. Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Spencer.
Present.
Alderwoman Tyus. Alderwoman Middlebrook. Okay, we have 7 present. We have quorum.
Thank you, Mr. Clerk. I would like to defer the excused alderman to the end of our committee hearing this morning. And with that, we have approval of the minutes. I am accepting a motion for the approval of the minutes from Wednesday, February 3rd.
Approved minutes from February 3rd. Second.
Hearing motion and a second. Mr. Clerk, please call the roll.
Alderwoman Gracia.
Aye.
Alderwoman Tyus. Alderwoman Green.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman
Aye.
Spencer. Okay, 7 aye votes.
Thank you, Mr. Clerk. With that, today, I want to thank you all for joining us. The agenda as we have it, we have no board bills for review and no resolutions, but rather we are here today to discuss 2 important issues. We'll handle issue item number 1 first, which is the discussion of the state of Missouri health efforts. And then once we get through that, we will discuss the health concerns at our city correctional facilities. But starting with the first 2, I'd like to recognize that we have 2 members from the state of Missouri here with us, Director Crumless, who is the Director of the Division of Community and Public Health for the state of Missouri, as well as Mr. Nodell, who is the Deputy Chief of Staff to the Governor's Office. I'd like to recognize Dr. Fred Eccles, who is our acting health director here for the city of St. Louis, who's joined us here today. I want to make clear on the front end that our goal here is to better understand the process through which vaccines for COVID-19 are being distributed so that moving forward, we can maximize coordination and better inform the general public about what it is we're doing. As Alderman, we are obviously receiving a lot of questions and concerns, and it's so helpful that we have 2 members from our state here to help us better understand that process from our state. We recognize that things are changing every day, every hour, and sometimes every minute. So we're grateful that you're here to share with us where we are at this moment and to talk about where we're moving very quickly towards in the future. As we all know, our purpose here and our direction is to help coordinate equitable and efficient distribution of vaccines to our residents, those that we were elected to represent, and especially those who are most vulnerable and at risk at long-term infection and fatality. With that, we know that this is taking shape every minute. In order to make this hearing the most efficient, we provided some questions and areas that we'd like to cover in advance. And I'd like to turn it over now to Director Crumless and Mr. Nodell. And following that, maybe you all can address some of the indicated areas that we'd like to cover today in your presentation, and then we'll open it up to questions from the committee. But in respect of everyone's time, I want to make sure that committee members are prepared to ask a couple of questions so that we can kind of get through everybody in an equal manner while still respecting the time of those here from the state of Missouri.
Thank you, Alderwoman. Appreciate that. It's a privilege to get to speak to your committee today and those in the community. This is Rob Nodell, Deputy Chief of Staff for Governor Parson. I'll make some opening remarks, and then Deputy Director Crumless from DHSS will dive in and address a number of the pre-submitted questions and other questions. Because he's living this literally hour by hour, 7 days a week. But just some information out there. The state, we've been at this, since December. I believe it was December the 14th when shipments first began to arrive in the state. Supply has been obviously very limited in the early going. We began with phase 1A, which was healthcare workers and long-term care facility residents and staff. And then we subsequently opened phase 1B, tier 1, which was emergency workers and first responders for eligibility. And we've also opened up phase 1B, tier 2, which is for individuals 65 and over, as well as individuals under the age of 65 that have a comorbidity that makes them especially vulnerable to COVID-19. The mission has been clinical from the start, which is to try to protect the most vulnerable as quickly as we can, especially given the limited supply that the state receives. And so, I think Adam can walk you through that allocation process, but I want to talk a little bit about the various streams through which vaccine comes into the state of Missouri and ultimately to your community. The first stream is the state allocation that we receive from the federal government of first doses of Pfizer and Moderna every week. And that number has increased from, approximately, we've had weeks where we received about 35,000 doses to try to spread across the state, which that's very, very difficult to do with the population that we have, and obviously doesn't go tremendously far in a given community. But we saw that increase into January up to a level of about 76,000 doses per week. And we've seen that in recent weeks increase to 88,425, and then this week 93,125, and next week we'll see that increase again to 97,525. So that is the state allocation. In addition to that, Missouri allocated doses to the federal Pharmacy Long-Term Care Partnership, which was a federal contract with CVS and Walgreens that has vaccinated approximately 95% of the long-term care facilities in the state, skilled nursing and others that enrolled in that program. So that's been a very significant allocation that has flowed through that federal contract. The federal government has also stood up and began this week, and I believe vaccinations will begin tomorrow, a separate allocation that goes to what they call the Federal Retail Pharmacy Program, which is again a federal agreement. The pharmacies they've selected for the state of Missouri, and those selections were made by the federal government, are Healthmart pharmacies and Walmart pharmacies. And they've indicated to us that program is going to be phased up with additional locations beyond what they've announced, increased allocations to those locations, and that the expectation is that in the future that the number of pharmacy chains or locations, facilities that will be included in that program will be increased as supply increased. And then a fourth delivery channel that was announced by the federal government this week is a federal allocation to federally qualified health centers, Fqhcs, across the state to try to reach underserved population. So those are the distribution streams. You know, three of those, or two of those are supplied through a separate federal allocation. We were required to take from our state allocation and put in that federal pharmacy long-term care partnership. And obviously, you know, we make the state allocations every week into state-enrolled vaccinators. So you have to think about that in terms of 4 channels. Those go to every region of the state, and the state has delineated that. And I know Director Crumbless will be referring to this, but the 4 delivery channels the state is using for our allocation, or 5, are high throughput healthcare systems, mass vaccination events, federally qualified health centers. We've been allocating to Fqhcs, but now the federal government is going to be making those allocations. And so, you know, we'll be obviously considering adjustments to that and building around that federal effort as more details become available. Other community health providers, as well as our local public health authorities. So it's a lot of moving parts and pieces. Obviously, supply is very limited. We've begun to be able to take back some of the vaccine that the Federal Pharmacy Partnership for Long-Term Care Facilities have not needed, that were over allocated based on the estimates the federal government had given us. And so, you know, we're going to be able to use some of that increased supply, and we're obviously optimistic about additional supply with the Johnson & Johnson vaccine hopefully becoming available and distributed into Missouri in the coming weeks. So with that, Adam, I'll turn it over to you. I know you've looked at the questions that have been presented and can probably get this into a much more granular level detail than I can.
Yes, so thank you very much, Robert, and most importantly, thank you to the members of the committee. Every time I hear someone say, Mr. Clerk, call the roll, it actually, I start to say something because in my former profession, I was a chief clerk for the Missouri House of Representatives, and so I appreciate the efforts of what you and all of your team there are doing to protect Missourians and keep people healthy and safe in the city. Also, special appreciation to Dr. Eccles for all the effort and work that he's done in helping to engage with us at the Department of Health and Senior Services to ensure that we also are working as closely as possible with the city. Couple of things that I think I'll just start at a high level. One thing I do have a question about is if it's possible for me to share my screen with you all. I can actually run through some slides for you. So I'm going to attempt to do this and see if I can make that work here. Let's see. So let's just start kind of at a high level here. From a standpoint of where we are, please be advised that this presentation is actually a day or two old, and so some of the numbers will have substantially shifted. Because with the efforts to vaccinate Missourians, it is certainly something that moves quickly. So if you look here at this slide, this is actually an effort that Dr. Williams, our director, was recently in partnership with Affinia Healthcare in the city, able to attend an event at the Community United Methodist Church there in St. Louis, and was able to work toward helping to vaccinate and engage with the community, and that is an event that he is extremely proud of and has talked a lot about since his opportunity to be there. We really appreciate that engagement, both from the city but also from Affinia as a partner, as well as our many other partners in the local community. When you look at just the overall COVID dynamics, as of the 9th, Missouri, per the CDC, was the 9th lowest in the country per 100,000 over the last 7 days of PCR confirmed cases. And so that put us at 18.3, but essentially 9th lowest in the country. Missouri data as of the 9th placed us at 4th lowest per 100,000 over the last 7 days. And then when you also include antigen tests, a different type of test, but also engaged for the purpose of diagnostic on COVID, we were actually 12th lowest in the nation. When you take all of those factors combined and look cumulatively, we're 16th lowest in the cumulative rate for confirmed cases since the pandemic started. So when we talk about vaccine allocations, one of the things I want to highlight for everyone, just for clarity, is process. And one of the things that I think it's really important to understand is that the way the allocation process has historically worked in the state of Missouri since December is that we essentially on Tuesdays get our weekly allocation from the federal authorities, and they tell us that essentially here's the totality of doses that are available for your order to be placed for the state of Missouri. So they tell us how much vaccine we actually can order as a state. Then from there, what happens is the state looks at all the orders across the state that we've received for vaccine and in all the requests. And then we have to make those decisions to go through and allocate. The first 5 or 6 weeks of the allocation process, the objective and goal that DHSS and the state of Missouri had was to target and focus specifically on the top 50 healthcare delivery systems in the state of Missouri. The rationale behind that was clearly because the two priority populations identified first were the elderly that would be engaged in long-term care facilities and staff in those facilities, as well as those that were the frontline health workers that provide care and services to those in the hospital systems. So for the first 6 weeks of the program, that is where the vast bulk of the allocation of vaccines went. So we are now heading into week 10. So we've had about 3.5 weeks of ordering that we've been engaged in. And during that process, our objective is to take those total allocations of what is available to the state of Missouri and then divide those out by region proportionally. And so when you look here, you'll see that from a base allotment standpoint, the state of Missouri essentially had about 88,000 to allocate as we're moving forward into the next week. And this is essentially our base allocation from the federal Operation Warp Speed. Now then, there's some other dynamics that, as Robert was highlighting, there are other channels that are not included in this. That would include some things such as vaccinations that were distributed to the federal pharmacy program through Walmart or through Walgreens and CVS that were aimed initially for those long-term care facilities. Those are not included in these numbers. Also not included in these numbers would be the newly launched federal program for Walmart and Healthmart pharmacies. Those allocations are not included here as well. And so this is essentially the channel that the state of Missouri has the opportunity to serve as the aggregator and orderer on behalf of all the other providers in the state. And just to be clear in that process, what happens is once we aggregate those orders and we submit those to the federal authorities, they authorize and then direct those to be shipped directly to the provider. So there's never a time in the state of Missouri that we are like sitting on a warehouse of vaccine. We actually, except in the rare circumstances where we're talking about an event for someone in our corrections or law enforcement agencies, or those in our congregate care, such as mental health facilities, there's never a time that we're really actually sitting on the vaccine or have access to it. It's a direct ship from the manufacturer of Pfizer or Moderna to the endpoint provider that can then administer it from that point. So when you go from there and you look at the enrolled vaccinators across the state of Missouri, you'll see that we have a relatively large distribution, and it's spread out across the entire state. Obviously, clusters where you would expect them in Greene County, Jackson County, St. Louis County, and St. Louis City, St. Charles County, as well as Jefferson County. With those enrolled vaccinators, what that means is those individuals or groups that have enrolled have gone through the process of both engaging to essentially have the ability to receive vaccine and then report the actual vaccination process as it has completed. So then I'm going to take a second to step away from this PowerPoint and move into a different slide here just to help provide some information for you. Can you see this slide, our dashboard?
No, we're
Okay.
still seeing the enrolled vaccinators.
Okay, let me see if I can do it this way. Does
Yes.
that have it for you?
It does.
Excellent. So one of the things that we're continuing to work on is trying to push out more and more data at a very granular level as we continue to move forward in the vaccine ordering process and the vaccinations occurring. So if you look at the data, this tells you that across the state of Missouri, 574,000 Missourians have received at least one dose, which is equivalent to 9.4% of our population. In the last 7 days, approximately 22,000 Missourians have been vaccinated. And then in total, both between the first and second doses, this is the total administration that has occurred. And so you see that is outlined in this graph right here. And what you see is those dips. Those essentially are the ordering cadence. So as I was saying, where the state of Missouri would essentially get the opportunity to receive order requests, we place those orders then on Friday or Saturday, and then they can start shipping from the federal authorities on Monday, which is why you typically are seeing this small allocation here, and then it goes up as the week goes on, and then it comes back down. So then as you look across the data, and again, this is all publicly available data at COVID, it's actually easiest to get to mostopscovid.com. This will tell you the percentage of individuals' ages, and this is not like the percentage of those that have been vaccinated. This is the percentage of the population in age range. So we feel like we're really helping to target those with the greatest mortality of the elderly at 30% for 85 and above, and then you see that those numbers trail down based on age. Now, these next two pieces are things that we have talked about with the CDC because we find these trends to be interesting from a data standpoint. First, if you look, there's a disparity clearly between female and male individuals that have received the vaccine. At one point in time, that was a 2-to-1 ratio, and our hypothesis was based on the fact that we certainly believe that there's an age gap between the male and female life expectancy. And then we also recognize that with those healthcare workers, there's a tendency for those to be more female than male. However, this anomaly is something that CDC is seeing nationally in their reporting. Now, when you look at the population breakdown by race, which is one of the things that we are concerned about, is you'll notice that there's a huge number of population reported as multiracial, while you see 12.8% of Native Americans, 2.8% of Black or African Americans, and 7.6% of white. The interesting thing that we've talked with the CDC about is this seems to be an anomaly that's facing numerous states where you see the multiracial component. And so we're trying to dig in and understand why that reporting category is substantially higher than others, and if there's a way to break that data out more effectively to be conducive to reporting on Black or African American, Asian, or others, or if that is consistent with the population as we would see. But obviously, with COVID, one of the things that we are aware is that it is a disproportionate impact on those of African American descent. And so we are continuing to look into this multiracial reporting to see what data quirks may be existing that would perhaps see a need to adjust some of those from a reporting perspective. But again, with CDC, those are data things that, from our understanding, they are seeing in numerous states and are also engaging in analysis to try and help clarify. So then when you look at the rest of this webpage for everyone, this gives you a breakdown of the doses administered by county. Obviously, for you all, we would be looking at St. Louis City, which is right here. So from a data perspective, you'll see 29,000 doses administered, first doses of nearly 20,000, second doses of nearly 10,000, 6.6% that have received the vaccine. And so as we're looking across the data, one of the things that certainly points to for us is that we need to make sure that we're engaging more in the city of St. Louis to continue the vaccine distribution. So I'm going to flip out of this piece and then go back to my other presentation to just finish up quickly there and continue answering the pre-submitted questions. Let's see there and get back to. There we go. All right, so I've run through those pieces just to help kind of provide some clarity on the vaccine rollout so everyone understands exactly where we are. As we were talking about those top tier priorities of the healthcare workers and long-term care facility folks, those are over here in the healthcare category of 1A. Currently 1B Tier 1 and 1B Tier 2 are open. We do anticipate that individuals in the 1B Tier 3 category will see access opening at some time in the future, but we don't project specifically when that will be because there are numerous variables that we look into to help make that decision. Then after that, there are disproportionately affected populations that will also open for equitable recovery, and then ultimately the general population of any individual that wants to see the vaccine. Now, a lot of information has been arrived at in the news media lately, and again, this is kind of an older slide, but in effect, what we worked to do, because as I was saying, we were getting weekly allocations, we sought to try and create predictability for the healthcare systems. And so what we did was by public health region, we created a high throughput health model that allowed us to really start projecting forward of allocations of vaccine for those high throughput systems. By definition, these are groups that can do 5,000 or more doses in a given week. And so in St. Louis County and City and the surrounding region, you will see that for just the high throughput health centers, there's a 15,600 dose allocation. And that is not the total allocation for Region C, nor the total allocation for St. Louis City or St. Louis County, but that is the one component that is reported as a high throughput health system. Additionally, there will be those other channels that Robert Nodell spoke about of local public health agencies, federally qualified health centers, and other medical providers, as well as one of the key roles being mass vaccination events. And this is one that we know that there's lots of questions about. So one of the things that the governor has activated the Missouri National Guard for is to help efficiently and effectively move vaccine into communities and get it engaged into the arms of every willing Missourian that they can engage at that time. So what you will see is that the state has stood up 9 regional events each week, and those will be happening on an ongoing basis. Now, for the city of St. Louis and the city of Kansas City, what we have really opted to do is a different model. Rather than setting up a regional schedule, what we have done is we've established targeted teams that are supposed to operate in a more surgical and focused way in collaboration with the local region to ensure that we're actually not just getting events set up for people to go to vaccine, but to be able to work with the local authorities to actually engage and put vaccine into the communities so that we can reach those disproportionately affected populations. This is something that has just been launched in this last week. And so as they are getting stood up, these targeted events are anticipating working with the St. Louis Urban League and other community groups to ensure that we're actually getting doses into the arms of people that may not be able to access care through the traditional health model. And so when you start looking at the purpose of the National Guard events, it's really to help be a direct support and engagement of taking vaccine into a place where they can reach citizens so that they can engage on that front line. So that's kind of the end of the presentation. I know there are still some other questions, but I know that I can be wordy. So I wanted to give anybody an opportunity. I can either continue moving through the the pre-posed questions, or I just didn't want to overstate my time here with you. So whatever works for you, Madam Chairwoman, what guidance you could provide me, I'd appreciate.
Sure, Mr. Crumless, this is really helpful. I will state on the front end that I was just informed by the clerk, reminded that the presentation will have to be sent to the board for our official record as it was presented today. Do you mind?
Absolutely.
Just sending that via email. Okay. There are, just for some clarification here, to go back, we have essentially 4 channels through which the vaccine is coming, one of which is through the states. The federal government is also going through Fqhcs and other channels. Within the state, there are 4 channels within the state through which the vaccine is being distributed. Am I understanding that correctly?
So I would actually say there are 5 within the state. So as it currently maps out, you have the high throughput healthcare systems, you have federally qualified health centers, you have local public health agencies, you have other community providers, and then in that final bucket is the Missouri National Guard.
But Alderwoman, beyond that's the 5 channels of the state allocation itself. But there are additional channels and additional supply that runs through the federal long-term care pharmacy partnership for the long-term care facilities, the federal allocation for Fqhcs, and the federal allocation for retail pharmacies. So yes, 4 pipelines into the state, but then of the state allocation, we use the 5 channels that Adam mentioned, if that makes sense.
Okay. That's very helpful. I think so. We have seen from your presentation that the vaccines have been coming out through the state channels starting in first or second week of December. Is that right? If looking at that timeline, Director Crumless?
Correct. I believe the first dose was December 14th, if I recall correctly.
Okay. And that was through those 5 channels through which the state is distributing the vaccine.
Correct.
Okay, and when was the city of St. Louis receiving? We have several entities in those 5 channels, right? The city of St. Louis being one of them, and then we have the 8 Fqhcs, long-term health facilities. Am I correct in that?
Yes.
And so the city of St. Louis has been receiving allocations through those channels since what time?
I would have to go back and give you a specific analysis, but I believe that some of those channels would have started through those first weeks with the healthcare systems. That if you have residents, for example, that are in a hospital setting that work in a hospital, they could have seen some of those initial doses that came in. They would also, if they were in a long-term care work status or a resident in a long-term care, they could have had access even in that first week starting in December.
Okay. And just for the data side of things, we looked at some of the aspects of those who are receiving vaccines at the state level, you recognizing some of the disparities in gender and certainly the disparities in race. Are those numbers reported on the local level as well?
So I know that right now the public website that we have does not go into that level of specificity on the local level,
Okay.
but we are working toward providing more data and clarity and capacity for reporting on that website, because one of the things that we want to be good partners and stewards of is being transparent with where the vaccine is going. And so we anticipate in the near term that we will provide more information specific to where the vaccine was distributed for public availability and awareness. But then also on those reporting categories, we're working on trying to provide a lot more data so that not just at the state level that we can use that public health data, but we also want to be good stewards and partner with our local public health departments, such as the city of St. Louis, to have access to that data to really be able to identify and map out where we may be seeing gaps in access so that we can then work as partners to go in the most effective way to get to those individuals that don't currently seem to be getting access.
So are we requiring those entities, those channels to make the reporting back through the state? So in other words, those high throughput, the local health agencies, are they required to report that information to the state of Missouri? And what is the timeline associated with that reporting?
Yeah, so when any entity actually delivers a vaccine or a vaccination into an arm, there is required reporting, and that is actually required to be submitted to the state within 72 hours that it has to get to CDC. And so essentially what happens is the provider works to report in. We ask for 24 hours, but know that the volume of data that sometimes requires may take more than that. And then what the state does is we de-identify that individual name data and then send the aggregate data or the individualized records that are de-identified into CDC so that they can also do additional analysis and verification of some of these same issues and concerns that we are looking at with disparities in gender and race and other populations.
Okay, but that information is required from all of the entities that are actually in the business of sticking the needles in arms of folks. That information is getting back to the state of Missouri within 72 hours of getting the needle in the arm, correct?
That is the objective. We know that with some of the size and scope, we know that 72 hours has been an issue for reporting timely, but we do consistently work to push on providers that have done those injections to get that data reported as timely as possible. Now then, I want to also draw clarity here just to make sure that I'm absolutely crystal clear. The data that is reported is the vaccination administration. I don't believe there is a requirement in the state of Missouri that they report all of the race and gender data, but I will verify that because I know that that's also a component of the data that we clearly are interested in. And when we get that data, that's what helps us do our analysis for moving forward. But I will verify that piece. But the administration data specifically has to go into the system so that CDC can verify information in their reporting.
Director Crumbles, that would be very helpful to get that because, I think what we're most concerned about is making sure that if there are gaps in populations, particularly in the high-risk populations in the city of St. Louis, that we have identified those and we can lean into the state if there needs to be additional avenues to which the vaccines can get into the arms of folks that are most vulnerable. But understanding where throughout the state of Missouri those gaps are is critical to being able to address those gaps quickly so that we can make sure we vaccinate those high-risk individuals who are the folks that are getting the most sick, at risk of dying, and of course, participating in the hospitalization and very costly burden for our community, both on a health perspective and economically. So
one other thing on that front, just to highlight, because we do look at social vulnerability index data that CDC puts together, but we also have a contract partnership where we are engaged with Deloitte to do a social determinants of health data set run as well to help us build out even more capacity for that identification as well, because it is something that's important to us that we're working with them as well as just some of the baseline CDC data. And so as that data set becomes more rich and engaging, that's also something we want to work with the local public health agencies such as the City of St. Louis Health Department to be able to engage and work together through as well.
I appreciate that. Thank you. I do want to give the committee members an opportunity to ask questions before we get too far down the road. So with that, I'll turn it over to the committee and go in order of seniority. Alderwoman Ingracia.
Thank you, Madam Chairwoman. I appreciate your allowing us to ask questions, and thanks, Robert and Adam, to you both for spending some time with us today. I have just a couple of quick clarifying questions to make sure I have information correct. I think it was Robert, you mentioned the state is taking back allocations of supply, but I missed where it's from. Which program had extra doses?
Adam, do you want to take that? I mean, it was the federal long-term care pharmacy partnership, which was the federal contract with Walgreens and CVS to vaccinate long-term care facilities. The situation there, the federal government gave us the number of doses that they wanted asked us to allocate into that program, since we had such a large percentage of facilities in the state participate, as well as the fact that they used bed capacity and a staffing ratio to come to those numbers. Obviously, many facilities in the state are not at capacity. Uptake rate of residents and staff has not been 100%. So the ultimate result of the way the federal government stood that up is there were excess doses allocated into that program, and the federal government has in recent weeks begun to make those available for the state to essentially take back and allocate to state vaccinators. So that is an ongoing process, and Adam may have a little bit of additional light to shed on that.
Okay.
Yeah, so
Oh, go ahead.
yeah, the only thing I would add to that is that as we're working with the CDC, obviously there's two things that we're trying to keep in balance there. Number one, we want to make sure that those facilities that were enrolled do see their patients and residents get vaccinated as soon as possible. And so we know that Walgreens and CVS do have some existing patients that are going to continue. But one of the things that, just from a data perspective, when the CDC made their determination, it was based on the capacity of each facility, not the actual census. And so when we were told what numbers we actually had to provide for that facility to get injections of vaccine, there was a built-in overage right off the bat based on what the federal authorities' number was. And so the process that we're working through is to claw back as many of those doses that were those excesses without negatively impacting those residents that are in the facilities needing to get the shots. And so I think that's a really important thing, that we want to ensure that those folks are getting vaccinated, but we also want to make sure that where there is that overage that was established by the federal authority, that we claw that back and get that into arms as soon as possible. Because we know that one thing from the epidemiological standpoint that we haven't raised yet today, there are variants of the virus that are out there, including a UK variant, as well as a Brazilian variant and a South African variant, all of which demonstrate a substantially higher efficacy for quick transmission. And so it's much more infectious. And so we're looking at this from the standpoint of, we're in a race to get as many vaccines into arms before those variants take deep hold in the state of Missouri. Mm-hmm. And we've only to this point had one reported case of the UK variant and none of the others. But that's why we look at this as an essential path forward for reclaiming those doses that were overages so that we can get them into Missourians' arms as soon as possible.
Okay, thank you so much. And then just for clarity, the federal retail pharmacy program, how is the state interacting with the federal government to, you indicated that Healthmart and Walmart were chosen by the federal government, but that they're phasing up with additional locations. How are you working with the feds to ensure that as many people in Missouri, in St. Louis specifically, have access to these retail pharmacy locations?
So one of the things I would say about that is there's not a lot of control or engagement from a standpoint of the state being able to shift that vaccine or decide that vaccine location. But we have had some conversations with the Walmart team, and because they're the first ones kind of up in that program, and we will be engaging more with the Healthmart folks as well. And just in the event you're not familiar with Healthmart, they're actually essentially the distributor on behalf of McKesson, which is the world's largest pharmaceutical distributor. And what they do is they essentially supply the independent pharmacies. So your non-Walgreens, non-CVS, more of the small independent retail. And so as they come online, we'll also be having more engagement and conversation with them. But we've also been partnering with the Missouri Pharmacy Association to help on those conversations and to keep everybody working together. But the access question in St. Louis, through that program is something that we are monitoring because it has been raised. I know that there's not a lot of Walmarts, if any, in the city limits. And I don't know if this is correct or not, but at one point I had been told that there was actually a prohibition of Walmart being in the city. That may be a fallacy, I don't know. But with the knowledge that there's not a lot in the city, I just want to make sure that we're continuing to think about how we get access to those vulnerable populations that may not be able to get to a Walmart or an independent pharmacy.
Okay. Yeah, and Walmarts are I'm sorry, just one moment. Walmarts can be in the city. I think they choose not to be in the city at this point in time. And to your point, there are only 3 Healthmarts. And so I know the mayor wrote to possibly the governor or the health department, Department of Health and Human Services, asking about including Walgreens and CVS, but that would be a decision of the federal government, correct? Not the state?
Yes, that is correct. To my understanding, that's definitely correct.
The one piece I would add as it relates to that is that as the federal government stands up these sort of separate delivery channels, whether that's retail pharmacy or FQHC, they do require the facilities to follow the state guidelines and tiers for who's eligible to be vaccinated. So even though, they're not acting as state enrolled vaccinators, they still honor the open tiers of who's eligible in the state of Missouri. So that is there is that level of consistency, and they asked us to communicate that we are in phase 1A and who that is, as well as phase 1B, tiers 1 and 2 in those populations. But again, I think those 2 federal allocations, FQHC and retail pharmacy, are going to be phased in. So my understanding is the pharmacies right now are only going to be receiving each a couple hundred vaccines a week. So it's going to take them some time to fully ramp that up. And so, I think it's important that we be transparent with what we understand about those programs, but also, to be clear that that's probably going to take some time to build out. And they have indicated that they'll be adding additional chains and locations in the future.
Okay, thank you. Just a couple more questions. Can you quickly go over, I know that St. Louis City is in Region C for the regional implementation teams that have been rolled out at the state level. Can you talk about, and St. Louis County is our lead, can you talk about what the implementation team is supposed to be doing in terms of supporting the city and how St. Louis County was chosen as the lead for the city?
Yeah, so Robert, I can take that. So a little bit of history on what the objective with the regional implementation teams was initially. When we had been going through the planning process, we felt it was important to stand up organizations for the purpose of collaborating across county-city lines or county lines in regions where you don't have municipal stand-ups in public health departments. And so we had submitted a request for proposal throughout all of the state. And when we did that, that probably would have been in November. We only received bids back from those public health regions that were essentially across the southern border of the states. And some of the concern that we heard at that time was there was concern that the amount of money being offered did not seem to cover the specific needs that folks thought we were asking to be covered. And what the real intent there is it is not to be the group that comes in and controls vaccine. It is not the group that is intended to come in and be the responsible party for ensuring vaccine delivery. It's truly just supposed to be a coordinating effort so that across jurisdictional lines, if one group is having a difficulty of getting access to vaccine for a quick turnaround event, that regional implementation team can serve as a coordinator to make some calls and try and get some additional supplies organized across the jurisdictional lines. And so really what it's aimed at is to help strengthen that larger perspective of public health that we see happen almost on a daily basis in the public health system, but also to integrate that with the healthcare delivery model as well, so that it doesn't just have to be an LPHA, such as City of St. Louis, contacting the local FQHC. They should also be able to have a network of capacity for somebody to help them reach out to either additional state resources or additional resources in other parts of the region. And so that is the intention of the regional implementation team. I know there were lots of questions about it and people trying to understand if that means that they're a controlling interest, so to speak. And ultimately, the state uses those regional implementation teams essentially to help coordinate when we need quick turnarounds or we need the ability to work across jurisdictions for specific problem solving.
Great, thanks. Can you also walk us through, it seemed concerning that St. Louis City was delayed by several weeks, subsequent to St. Louis County and St. Charles County and many other places in the state receiving vaccinations. And it seems like maybe there were some hurdles that the city had to overcome in order to roll out vaccines. Can you explain what happened and how the state and city worked together to rectify those issues?
Yeah, I think that's a great question. One of the things that I would highlight, because we had started receiving some applications for groups to be vaccinators early on in, I would suspect, November or December. But part of what we were also dealing with as we were getting into December and those initial vaccine discussions, as we had been talking about, was the big focus of what we were aimed at those first several weeks was specifically engaging those high throughput health systems and making sure that we were getting healthcare workers and those individuals in the long-term care facilities access to vaccine. So in, I think, the beginning of January, I want to say it was January 6th or 7th, Dr. Eccles reached out to our staff at DHSS and indicated that they were concerned because they had not been moving through the process as expeditiously as they felt they should be. And when we looked for their registry entry, we did not find it in our system. And if I understand correctly, there was paperwork that may have been sent in by fax. And ultimately, based on that communication with Dr. Eccles that day, we at the state turned that around, I think, in 24 hours for the initial step. The challenge that often comes in for all of these pieces is based on the CDC reporting requirements. The first step of enrollment acceptance, essentially, which we did within that 24-hour period, then also comes with a data requirement, like a data verification and transfer requirement. And so we have to work with each of the different providers to make sure all the data can be transferred and submitted properly. And that does take a little bit of time. And so I think, if I recall correctly, City of St. Louis worked with us to get that done in about a week, which is about the average time, I would say. I haven't gone back and actually looked at clocked information per se, but I think that's probably about the average time. The challenge that happened then at that point was based on the cadence of when those orders have to be placed. There was another week because of when that was completed that St. Louis City was not able to access vaccine. But what Dr. Eccles had worked with us on was trying to make sure that residents were getting vaccine. And so he asked that we started the process of getting some vaccine to private entity of Fqhcs for the purpose of making sure that vaccines were making their way into the city. And so, at least from my recollection and perspective, that's kind of the way that worked. We know that obviously everybody, including us at DHSS, would prefer to not have any snafus in the ordering or the enrollment processes. But I certainly did appreciate Dr. Eccles alerting us to the concern so that we could then engage and move forward at that point and get the city enrolled and start moving forward with vaccinating.
Great. Last question is hypertension an underlying health condition in 1B tier 2 or above?
That is an excellent question. I'm trying to remember off the top of my head. Hypertension, is it a 1B1, 1B2? I think it's a 1B2 if I recall correctly.
Okay,
I will verify that
can I read
for
you
you
the
as well.
can I read you the list quickly off the state website? I don't know if that's helpful.
Sure. Yeah,
Um,
that actually would be. That
okay.
would be the source I would go to verify.
Okay, 65 or older, cancer, chronic kidney disease, COPD, intellectual or developmental disabilities, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state from solid organ transplant, severe obesity of a BMI of 40 or greater, pregnancy, sickle cell disease, or type 2 diabetes.
So it's not listed on that site if I understood you correctly.
That's correct.
Okay, so one of the things that I know that when those decisions were being made on what was included and what was not, so for example, my understanding is type 2 diabetes is included, but type 1 is not. As we were going through that process, we were looking at varying points of data and the latest research available based on comorbidities for the purpose of formulating those lists. And so there are some conditions on there that I know individuals would certainly like to see added overall. But one of the things that was also really important to us is making sure that from a public health standpoint, we did not just abjectly interject the department's perspective in lieu of clinical determinations. So one of the things we made sure on was that in the event someone had a condition like that, we simply wanted them to talk to their physician, ask their physician to verify that, yes, in fact, they had enough concern about that condition to be engaged in vaccine at the earlier tier. And then they could put that in the medical chart, and that would certainly make that person eligible at that time. And so it's not a complete, I want to just be clear, it's not an exclusive list if a physician and the patient work together, and then ultimately the physician decides that that is a high enough risk of concern that the individual should go ahead and get vaccinated and put it in the chart.
Okay, I don't have any other questions right now. Thank you so much, gentlemen, for your time.
Thank you, Alderwoman Ingracia. Alderwoman Tyus. Alderwoman Green. Alderwoman Martin.
Thank you. Director Comless, thank you for coming here. I feel like this is like a reincarnation of our lives. But thank you very much for being here today. This has been very helpful. I do have a couple questions, not as data focused, but just sort of in general. It does feel, I know, well, let me just start out with, the frustration I hear from my constituents is that they feel like when it comes to just the general population that meets these, that meets the tiers or phases, they are being vaccinated in other areas, but St. Louis area is being sort of punished isn't the right word, but because we have the hospital systems that are treating people across the state, especially during this pandemic, we're sort of being, those populations are being held up and being vaccinated because those hospital vaccinations are counting towards our population, if that makes sense.
I think I understand. And one thing, if you don't mind, I would certainly tell you that the governor has emphatically made it clear to Dr. Williams, our director, and I, that he, with a law enforcement background, does believe that there should be more mechanisms of enforcement. And so Dr. Williams, anytime that he gets word or expressed concern about a specific facility or provider, he has taken it upon himself to call them and have specific engaged discussions about exactly what they are doing and whether or not they are following the appropriate tiers. And so that is something that I know he does literally on a daily basis himself, because he does believe in that importance of enforcement. But certainly we do have great concern if we hear of groups that are essentially jumping the line in front of others that have higher priority based on the established tiers. And if you do hear those concerns, we certainly would appreciate you letting us know about those.
Thank you. And it's not even just the people jumping the line, but and I know yesterday we learned that St. Louis will be getting more vaccinations, and I think everyone feels much better about that. But it also just shows that, you know, there are large disparities in these counties. I think 18% in Shelby County, and then St. Louis is at 6.5% of these populations. So not even just the folks jumping the lines, but also just that outside of the hospital community getting vaccinated. You know, for instance, my husband's 90-year-old grandparents can't seem to get vaccinated, and they can't drive to one of these other locations. And so I think the folks that are outside of the hospital community, they're seeing their contemporaries getting vaccinated at other places, or having the opportunity if they live closer in, you know, say Phelps County around Rolla, or even Salem this weekend. And we're not seeing that here in the St. Louis region.
So one of the things I would also highlight for you, just for awareness, as we're moving forward, we are also going to be working with some of our partner organizations, such as the area agencies on aging.
Okay, that's good.
We want to make sure that they can get access for those that are in those sort of areas of concern. So one thing I have not highlighted, and I apologize for this, we also have launched our Vaccine Navigator, which essentially is a registry system, so that individuals can sign up from a statewide perspective for events in the area, and then they can get notified on those events and kind of get access that way. But for senior citizens or those that do not have internet connectivity or capability, if they call our state's COVID hotline, those individuals on that hotline can also help them register at that Vaccine Navigator as well.
Okay. Yeah, I'm very encouraged to see the coordination with the Urban League. I don't think there's an organization out there that is better qualified to help assist administering the populations in St. Louis, especially those populations that don't always have great access to healthcare. And that's very good to hear about the area agency on aging. The other big population that I'm worried about is the disabled and homebound populations. You know, I know with Medicaid, there's Medicaid transportation out there. I don't know, is there any effort through the feds or through the state to reach those folks who are severely disabled or homebound, who cannot get out to these sites, even if they are within a few miles?
Yes, so I think that also highlights very clearly one of the key concerns from a public health standpoint. We actually are fortunate that DHSS has someone that is on fellowship assignment from the Association of State and Territorial Health Organization, or Health Officers Organization, that is specifically focused on disability advocacy within DHSS for this purpose. Her name is Sarah Weir. And the thing that she's been working through, we also have an equity committee on advisory, or an advisory committee on equitable distribution that aims to help us get those networks and coalitions built to work at the local level for those purposes. And so we've got, as you mentioned, the Urban League. We're working with the NAACP, Rod Chappell there. We're working with the Empower Missouri organization. And so we've got a litany of different groups on that committee. They meet every Thursday at 1, and those are public meetings if anybody wants to listen in.
Okay, that's helpful. And then I had one last question. I've taken so many notes, I've kind of lost my questions here. One second. Well, I'm not sure. I may have to pass along my turn and come back. But let's see. Oh, and then is there any talk at all about bumping up teachers in these phases?
So one of the things I'd again highlight, if there's somebody that has one of those conditions,
right,
and they're under 65 or over 65, certainly they're already eligible. But then beyond that, we know that there's a lot of different tiers that people would like us to move more quickly on. And the thing that we really wanted to establish those tiers on the basis of was really first mortality, saving lives. And we do hear from a lot of teachers and individuals that are concerned. But at this point in time, I don't believe that is the path that the state is taking. I do know, however, that there is a process for adjudication that is being set up for groups to express their concerns on that sort of a front. And we will provide more information once that becomes available.
Okay. Yeah, I think that one of the big concerns in an urban area like St. Louis is we have so many students going home to multi-generational households. And, you know, it's just kind of the chicken or the egg, because the same people that might fit into the tier now are taking care of their grandkids or live with their grandkids, but they haven't been able to get the vaccine either. So, you know, it's twofold with those teachers. And I know my last question is the studies from Deloitte, will those be made public?
I apologize. I cut out on you there, and I missed part of that.
Oh, you're fine. Oh, I was asking if the studies and communications with Deloitte, will they be made public?
Yeah, I know that we've provided those on request. I don't think that'll be a problem at all. In fact, last week in our Public Equity Advisory Committee, that was one of the presentations they did. So yeah, we can certainly do that.
Okay. And just one, sorry, I said I had last question, and I just had one more follow-up. I know last week, Dr. Williams was saying that are we still on par with about 84,000 a week, 84,000 vaccinations a week? It looked like from your numbers, it was like 50 something plus 28 something. So is that about right?
And so the allocations bumped up a little bit again this week, as I recall. We're getting more Moderna. And then we will also see, just for clarity, we'll also see kind of another one-time infusion from those doses that we're reclaiming from the federal pharmacy program at Walgreens. And so those are also going to be a larger jump this week on the basis of allocation. So there are more doses you'll see this week. And those numbers I anticipate will continue to climb. One of the things that I think is important is I know there's a lot of confusion about how much is who getting. And when you look at the data, we actually would tell you that we feel like we're in pretty good parity. And we dispute the number of 15,600 that individuals have been quoting about the Region C getting. It's clearly more than that. And so that's one of the issues that I think from a data standpoint, you'll be able to see that there's a lot more doses than the 15,600. And then those numbers do continue to climb. One of the other things that we're looking very anxiously toward is we're hopeful that in the end of February and the beginning of March, we will see the Johnson & Johnson vaccine come online, which is a one-dose vaccine,
Yes.
Which has, I think, some very legitimate and appropriate uses in communities of homeless populations and similar groups where getting a secondary contact may not be likely. And so from what we're hearing, that will be a huge bump, potentially, that we'll see a ramp up in the month of March again.
Okay. You know, because I'm just looking, and I guess this includes, I wasn't thinking when I was doing the math in preparation for this hearing, but, you know, I'm thinking vaccinating 3 million Missourians, 84,000 a week, that's 35.7 weeks. So it's like, oh, great, everyone's going to get vaccinated within 9 weeks. But I guess that includes the that we're talking first and second dose, not just one of those doses, correct? Am I making?
So when you're looking at those numbers in the chart I was presenting, those are just the first dose allocations. The second doses are separate from those numbers.
Okay. All right. Well, thank you so much. I appreciate your time and Mr. Nadel's time as well.
Thank
Madam
you.
Chairwoman,
Thank you, Alderwoman. Appreciate we had the opportunity to work with you here in Jeff City, and have always appreciated the chance to work together.
Likewise, this has been helpful.
Very helpful. I want to be mindful of everyone's time too. But I do want to get through the committee. Alderwoman Heather Navarro, our vice chair here, who was instrumental in helping to put together the questions on the front end and in organizing this meeting. Alderwoman Navarro.
Thank you. And yes, thank you. This has been very helpful. Most of my questions have been answered. I do just want to go back to make sure in terms of the numbers again. I know, and we just went over these, but I just want to be clear. So earlier I think the chart said, we're anticipating for the state 97,525 doses. And so does that include the federal, retail pharmacy program? Does it include all of the channels, or are you talking just about the state's doses?
That is state allocation only, and so that does not include vaccinations that are occurring in the federal long-term care partnership, the federal retail pharmacy partnership, or the federal allocation to Fqhcs, which we understand will be beginning next week, but we don't have great clarity on that Fqhc piece yet. So that number that is a state allocation number.
Okay, thank you. So, okay. And then, so when looking at the dashboard, is that a total number of all of those, or is that focused on the state allocation? Looking at that.
So those administered doses are going to be cumulative of all doses in the state of Missouri, irrespective of source of throughput, because essentially what this data is representative of the actual administration data. So once it goes in an arm, it has to be reported irrespective of what channel it comes through.
Okay, great, thank you. And then, so there are these 5 different channels that people can access the vaccine through. And you touched on this a moment ago, but in terms of like our unhoused population, it seems there's a bunch of different pieces of this that people are looking out for, but then I just am wondering, like, who's looking big picture over this to identify the gaps? And you've talked a little bit about the Deloitte information, but I guess specifically the unhoused populations, like you mentioned, the homebound population, and there's a contact at DHSS working on that. What about the unhoused population? Is that through the urban, urban league participation, or how are we hoping to identify those folks?
So yeah, I think that one of the things that we ultimately will be looking toward there is integrating with the local health department, because one of the things that we think is very important is the data that we see consistently tells us that individuals will be more likely to get vaccine if they have a relationship with a specific healthcare provider that's advising it, or if they have a relationship with a local health department that's advising it. And so specifically, what we typically see is those Fqhcs on the ground, those local public health agencies such as St. Louis City Health Department. They typically are going to have more insight into those specific populations because they are the least likely to get access to care through the traditional methods. And so we're going to engage a lot with them as we're continuing down this path. But we utilize the Social Vulnerabilities Index, the social determinants of health data, all of those different components in working with all of our partners. And one of the things that I've appreciated is even one of our National Guard leaders that's engaged in the process is going through that same data to make sure that as we're tasking the Guard, that we're not putting people in places that can't or we're not putting people in places that are all accessible. We're trying to get them to people that also do not have access.
Okay, thank you. And with the doses that go to the Fqhcs, is that going to, people have to be registered through that Fqhc as a patient of that Fqhc to receive the dose, or will anybody be able to show up? I mean, as long as they meet the criteria, eligibility criteria. Yeah,
so our clarity has been that because this is a federal asset, it's available to any Missourian. That's the expectation, and we expect all of our partners, whether in a high throughput health system, a hospital, a local public health agency, an Fqhc, or any other group that's going to be a vaccinator, we expect them to collaborate and cooperate and share vaccine across those lines in the best way possible. And so we don't expect that you have to have a patient relationship. In fact, one of the things that's interesting with the federal Walmart program coming online, the Sam's Clubs will also be doing that vaccination. Even if you're not a Sam's Club member, which you historically would have to be to get into a store, if you're going for a vaccine, you do not have to be a Sam's Club member. And so our objective is to get the vaccine in arms as quickly as possible. And we don't require those relationships to get the access to the vaccine.
Okay, great. That's super helpful. And then just two hopefully quick questions here. So in light of the fact that in Lewis City, we don't have very many Healthmart or any Walmart, we do have, CVS and Walgreens. And so when we're looking at the number in totality, we know that a lot of St. Louis City residents are not going to be able to access the federal retail pharmacy doses. So is that something that, we can bump up the state allocation to make up for the fact that we won't be getting doses through that program?
Yeah, I think there's certainly a lot of open creativity opportunities that we've got to collaborate. I think from our standpoint, the most important thing is just getting it at arms quickly. And so I know that the governor's office certainly is very committed to just working to get that done. So as you see suggestions and ways to do that, we're certainly open to those dialogues.
Okay, great. And then the last one I have, we're kind of assuming that everybody who's eligible, whether they work especially I'm thinking about the very first phase, so the folks working in the long-term nursing centers, and the residents there, as well as our healthcare workers on the front lines. Do we have an idea of the number of folks who are accepting the vaccine? I mean, how many people are choosing not to get the vaccine at this point? Do we have numbers on that? And I realize this is not
a little bit. Yeah, I cut out a little bit about that. So I think you were asking me kind of what's the percentage of people that are declining vaccine. Is that correct?
Yes.
Yeah. So interestingly, we're seeing different numbers based on population, and it does seem to rise and fall to some degree with education and socioeconomic status. But we are also seeing, and Robert, I know, has looked at this data very closely as well, we are seeing that in nursing facilities, for example, 65% of the eligible population, which would be the total bed count essentially, of residents are taking it. So when you account for the fact that it's not the bed count, it's the actual census, that's a pretty high number of what we're seeing in those elderly populations. What we are seeing in the staff of those facilities, for example, is a much lower uptake rate in the 35 to 40% range. And again, we're seeing that data does tend to rise and fall with socioeconomic status. The other issue that we are very acutely aware of and are working with partners on is messaging specific to different communities of interest, such as people of color, people in minority status, people in those different homeless populations, how you do really tactical on-the-ground messaging and communication to help build up the efficacy of participation in the vaccine. And we're working with all those partners specifically to engage a pretty substantial media blitz across numerous channels. But we also know that it goes back to those on-the-ground relationships that are going to be really the influencers that get those populations done. And so that's ultimately going to mean working with homeless shelters, working with collaborators in the disability rights groups, and all of those on-the-ground partnerships that are going to be really responsible for helping us drive that.
Great, thank you. And since you mentioned, the ad campaign, so will we expect to see, billboards here in the city of ads that are being put up by the state in terms of where to go to get vaccinated?
So I think, yeah. I don't know about billboards specifically, but I do know that there's a pretty involved and engaged media campaign. We typically work with a partner there in the St. Louis area called Elasticity. That's a group that has worked very engaged in public health for a long time, is my understanding. And so that's been a primary channel for us to work. And I know, for example, one of the things we often find effective is those side of the bus advertisements. And so we do some of those, all sorts of things that I found that team has a lot of creativity to guide us in reaching those more vulnerable populations.
Great, thank you. I have no more questions. Thank you so much. This has been very helpful, and I'm hopeful that we can all kind of figure out all the, looking at all these different hurdles at both the local, state, and federal level that we're going to be competing with. Thank you.
Thank you, Alderwoman Navarro. Alderwoman Middlebrook.
My questions have been asked and answered. Thank you.
Thank you, Alderwoman Middlebrook. Alderwoman Rice.
Thank you so much, Madam Chairwoman, and thank you, gentlemen, so much for being with us today. I know you've spent a good amount of time here, so I'll try to. A lot of really good questions have been asked and answered. I just had a few follow-ups. So going back to the Walgreens and CVS programs, so they're enrolled as vaccinators, but only with the federal government as far as the long-term care facilities. And so are you saying there's not an ability for them as pharmacies to be able to turn around the stock that they have, the vaccine stock that they have, to qualifying populations outside of those facilities?
I apologize. I think I got lost in your question.
Sorry, that's fair. Since this is a federal program that has allocated doses to the Walgreens and CVS pharmacies, so you're saying that they are not going to be, they're not going to be allowed to then use their excess stock that has not gone into the long-term care facilities or is not needed there. They're not going to be allowed to turn that around to qualifying population surrounding them. Like they can't use it. You're asking for that back to then reallocate.
Correct. So let me, just for clarity there for you, the doses that went to that program, even though that was a federal program, those were doses that we as the state of Missouri allocated out of our allocation. And so what we've asked them to do is essentially give those back to us so we can move them into channels for exceptionally quick delivery. And that's the engagement that we're working on right now with them as a partner. That's different in the model from what is happening with the Walmart federal retail program. That's literally on top of the allocation. But the way that first federal model for the long-term care facilities worked, those were taken directly out of the state allocation. And so we're trying to essentially get those back to expedite those as quickly as possible back into the distribution chain.
Okay, that's helpful. Thank you. And then as far as the numbers on the dashboard are great. I very much appreciate the statistics per population as well. I think that's a really helpful way to look at it. Do we have any documentation of the percentage of vaccine doses allotted per state population? Is there, so I guess looking at the maps, looking at the data, it looks as, the St. Louis area with 40% of the population. Is there a direct comparison to say we have received 40% of the doses that the state has allocated, or are the numbers collected that way?
So I know that we have all that data. We can work through that, but I know, for example, the concern that's been expressed publicly in the media has been that the St. Louis region is only getting 15,600 doses. And while it's true that 15,600 is that high throughput allocation, there's a lot of other doses that are also going into the region that don't count in that. But we can certainly work to try to get to clarity as to what you're looking for. Because one of the things that we ultimately are wanting to do is also put out for everyone to be able to see transparently what were the requests we got and what were the distributions that we actually made. So everybody gets ground truth and clarity straight, one source to understand exactly what we've been working through in our decision making.
Sure. Okay. That is also helpful, because there was some question as to, because we have so many high throughput facilities in the St. Louis area, we have so many hospital systems, are the allocations, so you're saying the numbers are separate for what is coming through those high throughput facilities, and then there are also other allocations coming to the local public health care or the local public health administrations. So are these the same numbers, or are they separate numbers? Are there different doses going to each entity, or does the hospital system get them and then distribute them?
So one of the things that we have indicated to the hospital systems is that we do expect that they should be working with partnerships to allocate vaccine in the most effective way possible. And that means engaging with other partners and doing vaccine share with other partners. But we also recognize that, for example, public health agencies do have a separate allotment. Federally qualified health centers have a separate allotment. The National Guard has a separate allotment. And so those categories in totality, I think is what you're really asking about.
And I would add to that, as we talk about public-facing data, one of the things our data team is working on at the state level is what I like to call Dashboard 2.0, that hopefully we'll be able to release very soon. That will have a lot more allocation information in terms of order requests, orders fulfilled, and just more, even more granular information as time goes on, and as we reach the tiers that get closer to the general public. We want to make that, continue to enhance that visibility for the general public. And so, I think your input there is very helpful because it sort of gives us more direction in terms of what folks would like to see.
Absolutely. Yeah, I think there's some significant confusion around how those allocations are coming to the St. Louis, the state allocations. So not the federal programs, but the direct state allocations. If those are coming through the hospital systems, if they're being asked to give some of their vaccine doses to the local health department, or if those are coming directly from the state to the local health department, right? So are those two separate numbers, or are those together? I guess that would be helpful for clarification. The last question I had was about the tiers. So is there a percentage of the total population within a tier that needs to be vaccinated before we move on to the next tier? What's our criteria for moving on?
Yeah, so I will tell you that we don't have a specific target number or a specific target date. I can't tell you today that we have on this date, this is when we're going to hit it. Some of that is really going to be dependent upon supply. As we see the supply chains open up more, that is a factor that we have to consider, because we think that we have the ability to then more effectively open up the tiers. One of the other things that we have to consider is, as we are looking through the size of the tiers, how those are going to compare versus that supply that we're projecting. And so there's a lot of those different type of dynamics that we look through in that process, but there's not a silver bullet sort of approach that we're taking. It's really aimed at trying to, for lack of a better term, hit the sweet spot of all the different factors and influences that we see on when is the appropriate time to do that. One of the things that we also know is that we don't want to just open a tier and say, okay, suddenly everybody is now engaged and available. We want to give some folks a little lead time to be able to plan for these next steps, because we have huge populations that will come through those. And especially for those employers that are interested in doing large vaccine clinics for their employees, there needs to be some logistical coordination and capacity there. And so I think you'll see that before we get to that point of just announcing the next tier, that there will be a lot more thought and detail expressed publicly, so everybody is kind of being in that gauge to be preparing for it.
Okay, that sounds good, because tier 3 has a lot of specific work functions, I guess, workforce functions, and it probably, especially with schools and some of these others, it may be helpful to get vaccines directly to those employers, so that we can get those folks vaccinated as effectively and quickly as possible. Since it seems a little bit more defined than, or easily defined, maybe easily identifiable than some of the health conditions, because you'd be working with specific employers. So any way that we can be helpful in coordinating with, particularly employers in the St. Louis city, we'd love to be helpful.
Yeah, we appreciate that, and would certainly take you up on that partnership.
All right. Thank you so much, gentlemen. I have no more questions.
Thank you, Alderwoman Rice. Alderman Todd.
Thank you, Madam Chair, and thank you, guests, for sharing that valuable information. You have answered my questions, so thank you again, Madam Chair.
Thank you, Alderman Todd. I want to be mindful of everyone's time here, especially those folks here are joining us from the state. I have a couple of additional follow-ups, and we'll see where we're at. The most important issue to me really is to address disparities in getting the vaccine to folks. We mentioned this earlier. The reporting, I think, is really going to be key to understanding where there are gaps. So, Director Crumless, I'm going to lean into you to share the reporting that we have both at the state level and addressing those mixed race categories, but also here locally where we are here in the St. Louis area and making sure that we have access to those numbers and they're communicated with the general public regularly through state site or local sites. That's not just for the city of St. Louis, but all of the healthcare facilities, et cetera, within our jurisdiction. I'm concerned about Walmart being one of the sources. We touched on this a little bit earlier, and some of those distribution mechanisms that aren't here in the city of St. Louis. And I would like you to talk about how we're going to make up the difference in distributing outside of those channels, specifically when it comes to the National Guard and a mass vaccine site, making sure that we're keeping tabs of not just getting the numbers here in the city of St. Louis, but we have a disproportionate number of people that are in high risk categories. And so I don't want to see the vaccines just allocated to the city of St. Louis based on population. It's really important to take into account the number of people that are at high risk here in the city of St. Louis.
Yeah, so I certainly agree with you on that, and that's kind of for us, the risk factor is really the driving north star, that the higher risk we see for mortality, that's where we want to see the population focus, and that's obviously why we started with those long-term care facilities, just based on the data where the mortalities were the greatest. But one of the things that I certainly would also share with you is that as we continue to work in these distributions, we've tried to be very clear in our communication that we do expect all the different channels to work together to solve these as community problems, that they should not be engaged in simply providing vaccines to their specific patient base or their specific group base that they may work with, that we want this to be a broad-based access to the community, and we want to get it into the arms of those with the most vulnerabilities that we see for that mortality rate. And so we will continue pushing that message and look forward to continuing to build on the partnership with the hospitals, the engagement with local public health departments like Dr. Eccles and everyone else in the delivery model with the LPHAs, the Fqhcs and everyone, because ultimately these are not hospital system problems. These are not LPHA problems. These are not Fqhc problems. These are Missouri problems. And from the state, we look at it that way, that we all owe it to each other across the state to work together to take care of our most vulnerable. And that's our objective.
I appreciate that, but I think specifically, are we going to be doing a mass vaccination site here in the city of St. Louis? Or is there going to be some effort beyond just leaning into the existing channels?
Yeah, so I don't know if I touched on it adequately or not, but we are going to be sending a targeted team approach from the National Guard to work with the local jurisdiction. And really the model we're looking there is not a person goes to the vaccine, but the vaccine goes to the person. And we anticipate a specific ongoing schedule of events or manpower and service to help coordinate that in the local community there. And so that is something that we anticipate they'll work with the city, work with all the different players to do the best to get vaccine to those individuals. We do recognize that there are sensitivities that we have to be aware of, and recognize that we want to make sure that we put the Guard and everyone else engaged in those processes in the best possible way to be successful. And so we are certainly going to work and lean in for participation, but guidance at that local level to make sure we're doing it in the way that's most effective in the community. And so you will see an ongoing weekly event from targeted teams in the region that the National Guard is standing up to be able to help specifically in the St. Louis City area.
That's helpful to hear, Director Crumless. That we'll look forward to communication on that as that unrolls. Speaking of communication, it's been a little bit confusing where folks are supposed to be signing up for vaccine, if it's through the state, if it's through the city, where, what is the best guidance you can provide to citizens on, where we should be directing them to make sure that they are first in line to get the vaccine according to their tier group?
Yeah, so I will say if they sign up through that Missouri Vaccine Navigator, they will go through a questionnaire, and that will help assign what tier they're in. And then once it shows them what tier, it will give them the opportunity to register for notifications and sign up for events in their region, specifically based on that tier availability. One of the things that we know is a bit of a challenge is that especially in some of our major metropolitan areas, that there are lists of thousands, if not hundreds of thousands of residents or people that have already signed up. And we're trying to make sure that we don't create duplicative information there. And so whatever guidance that Dr. Eccles or the city or folks would have for us would certainly welcome that on how to best engage on that partnership. One of the things that we are interested in trying to get to, but it is certainly a massive hurdle with 114 different jurisdictions doing things different ways, is we would like to be able to get that data all in one place so that all residents have a single source that they can go to and get the information. But we also know that there may be those in the local communities that think that's a step that's not going to bear enough fruit. So we're really trying to work with the local communities to help decide those steps. But the biggest thing I would tell you from my viewpoint is there's two schools of thought. School one is clearly register everywhere you can. The good thing is you're obviously going to more likely find a vaccine potentially more quickly. The downside to that is what ends up happening is we see, at least we're hearing from the different healthcare consortiums, that results in a lot of no-shows because somebody will sign up on 5 lists. They go and get their first dose of vaccine, and then they miss the other 4 appointments. And so that slows down the overall distribution of vaccine. And so that's the dual-edged sword. But certainly my advice would be make sure that you're in your local place where you normally get your care. I would certainly sign up there. I would urge everybody that is interested for a statewide perspective to sign up on that Navigator. But then also I would certainly urge them to work with the city health department to engage as best as possible, as Dr. Eccles would suggest.
Okay. Yeah, I mean, that's just, I appreciate that answer. You apply and sign up wherever you can. It's just so frustrating that there's not a, centralized, coordinated approach. I realize we're doing something for the first time, but it is unfortunate to have that disparate set of signups. But I do appreciate that this is changing every day, and maybe that can shift. I would like to see it be more coordinated, especially for our low access residents who may be challenged to even sign up in one place and have to then try to figure out how to sign up in multiple places. It feels like that would result in those who have most access getting the vaccine first.
Right.
We've seen over the last few days, weeks here in St. Louis, such a large number of issues within our incarceration facilities locally. Is there any effort in the state to roll out vaccines where in facilities, in our incarceration facilities statewide or other places where, people can't socially distance and they have to live in close quarters with one another beyond just the long-term care facilities?
Yeah, so that is definitely a tough circumstance, not just because it is a congregate care sort of facility, but because there are other obvious security issues and safety issue protocols that people have there. We have been engaged with our Department of Corrections to help look for best practices in those sorts of arenas so that we can also continue to help figure out best ways, not only to get vaccine to facilities, but also to get vaccine to facilities in a way that will work efficaciously and quickly from a delivery standpoint. And so we're going to continue working through that. But we can engage our state partners at Department of Corrections with your local folks if that would be an interest to you all.
I think it would be, absolutely. And I'd like to follow up to make sure that we do, in fact, do that. And statewide, we're considering these local incarceration facilities. We've had some uprisings within ours. Some of those are related to COVID safety and other issues. So making sure that we're putting first those that are in those individuals in our custody, I think is an issue of equity, certainly, and one of justice.
yeah, we definitely can make that connection. I will reach out to our Deputy Director of the State Department of Corrections and have him make connection with you all.
Appreciate that. And lastly, I mean, you know, this is not, please don't, you know, take this as a pointing of fingers, but it does certainly seem like St. Louis is lagging behind, you know, the St. Louis region, but the city of St. Louis in particular. You know, we are the revenue engine of the state, and, you know, seeing us continue to lag behind is problematic for a lot of different reasons, but in particular because we have so many members of our population that are in vulnerable categories. But you know, continuing to see shutdowns and lack of being able to open up the economy is going to have a major impact on Missouri's revenue. And so I'm hoping that you can help us understand what it is that we can do better in the policy-making body, but as a city as a whole, or even broader than just the city and a broader St. Louis community, to get the vaccines out in the economic engine of our state. And what the holdups have been so we can identify them and move past.
Yeah, I appreciate that. And one of the things that I think from my viewpoint that I would highlight is that your leadership of this committee of stepping into the issue and asking and building this dialogue, I think, is an important part. That is a first good step. I know that we've been able to engage and work with Dr. Eccles over time, that I think just continuing to build the relationship for the sharing of information is really a key. But the other thing that we can do is we can certainly work with our team to help come up with some additional identified strategies to help work with the city in getting the engagements of vaccine in an effective way, and continue to build out that ability to deliver it in those vulnerable populations like you were speaking of. And so I think one of the things that I would just say is the dialogue in particular is always a great starting point and the springboard for really collaboratively working forward. And so I think that this is frankly one of the best steps that you all could take, and just appreciate the opportunity to engage and work together on it.
Well, Director Crumless, I really appreciate that. And I have to say that I am impressed and grateful for your willingness to come before our committee. When requested of you, there was not any even moment of hesitation as far as engaging. And while the city of St. Louis and the state of Missouri are often at odds with each other politically and in other ways, certainly this has been a process that was extremely easy to put together, and one that was collaborative, and I think is indicative of mutual interest in improving the system and results for the citizens of St. Louis and Missouri as a whole. So I look forward to continuing this dialogue. I do recognize that we have members of the committee here who weren't able to ask questions because of the timeline. So I want to state on the forefront that we will continue this dialogue. Alderwoman Evans in particular has her hand raised, and without having the time left to open it up to the additional aldermen here, I'd like to invite Alderwoman Evans and others here on the committee who may have questions to submit them through the committee directly to you, Director Crumless, so that we can work on getting those additional questions answered in a timely fashion so that she can get those back to her constituents and we can make sure that all questions are addressed. Would that be okay with you, Director Crumless?
Yeah, absolutely.
Okay, Alderwoman Evans, I'm so sorry. I know Director Crumless has previous obligation. He's already been so generous to continue to stay on longer than anticipated. But I will follow up with you immediately after this hearing and make sure that we get all your questions directly to them today. Okay? Anybody else who's not a member?
Or maybe it's something that you can answer.
Sure.
Because all I wanted to know is, you know, I have several, at least 4 senior facilities, and they were wanting to have the vaccine given on site. So did you address that question? If there's a facility large enough for them to have vaccine brought to their site, is that a possibility? That was the only question that I wanted to ask.
I think to maybe make sure that we get it specific to the 4 facilities, can we get the names to Director Crumless today, and we'll have him look specifically in those, Alderwoman Evans, and that way if there's a size issue too, we can communicate that more broadly for other alder people who have facilities within their wards so that we can all kind of share that information.
Sure.
Director Crumless, would that be okay with you? Would you mind giving us that information later today? Okay.
Absolutely. We can look into that. Not a
Great.
problem at all.
And with that, I'll make sure that we get the presentations that were presented today and any additional questions from members not of the committee so that we can continue this dialogue. We're so grateful for you to participate. And I don't know if Dr. Eccles is still on the call here, but I did want to make sure that we give him an opportunity to speak or share any information or any updates that he may have for the committee while he was so gracious to join us today. I don't see him jumping on, but oh, there we go. I did want to thank you, Dr. Eccles. We understand that you presented some information to the president of the board last week. It was distributed to us late last night. We're grateful that got to us, and we welcome you to share information directly with the committee or the Board of Aldermen to avoid any time lag in the future if that's possible. Dr. Eccles, we are glad you're here with us. We cannot hear you at the moment, but we're grateful that you've stuck with us for so long here today.
Thank you. I just want to say thanks to Director Crumbliss and the team from the state. You know, they've been great partners throughout the course of through the pandemic, and we continue to work closely together to make sure there's a smooth vaccine rollout, as well as we want to also receive clarification on some of the information that was provided regarding eligibility. So they've been amazing partners to make sure that we comply with their vaccine distribution plan. So we're, again, grateful for the partnership that we have with the state and our local stakeholders.
Thank you, Dr. Eccles. Did you have any other information that you wanted to share with the committee at this time? I know we gave you a series of questions several days ago, and I know it's a large number of questions on your plate that may not all be able to answer today, but if you wanted to share any additional updates, it would be helpful.
Not at this time. I will say the trajectory of cases in the city of St. Louis are moving in the right direction. Today, we're finally reached 5% COVID-19, 5% positivity, 5% positivity rate for COVID-19, which is, you know, we haven't been at this point in a long time. So things are moving in the right direction, but we continue to urge our residents and visitors to comply with those other COVID-19 mitigation measures. So wearing face covering, social distancing, practicing good hygiene, and staying home if you're ill to further slow the spread of COVID-19. Because those measures will continue to be important even after a vaccine is available for the general population. So thank you.
Thank you, Dr. Eccles. And thank you all for participating again to the folks from the state who joined us today. Director Crumbliss, Mr. Nodell, you know, I mean, again, it's really, really helpful to have this dialogue. I think we all learned a tremendous amount and hopefully forged a better relationship to move our community forward in a way that better protects the health and safety and the well-being of our communities and addresses the concerns and issues that we're hearing on a regular basis. With that, I look forward to continuing the dialogue, and I'm grateful to hear that this has been useful for both sides of this conversation and moving us forward. So we will be sure to invite you back as we move through this this pandemic.
Thank you, Alderwoman. Appreciate it. Thank you very much.
Thank you. It was a very serious investment of time, and we are grateful that you're able to do that with us today. With that, I'd like to, in the last few minutes here, you know, recognize that we did have another item for discussion, the discussion about health concerns at our city correctional facilities, recognizing that we really only have a few minutes left in our hearing today. I want to point out that we did talk very briefly about vaccines in our correctional facilities statewide. To get a response from Director Crumbliss on that issue, I think will be helpful and instructive to the city of St. Louis. We could take some questions or thoughts from the committee, but recognizing that we only have a few minutes left, I think what would be best for us to do at this point is recognize that we had a series of questions presented to Commissioner Glass a couple of weeks ago. It's my understanding, Alderwoman Negracia, who did an amazing job organizing that information, those sets of questions. Alderwoman Negracia, have you received any sort of response? I know I don't believe I've been copied on any further communication on those questions. Can you clarify?
Thanks for the question, Madam Chair. Any responses I've received, I've forwarded to the committee, and the last response I had from Commissioner Glass was that they were still working on the responses to the questions the committee came up with, that they did not have an estimated time in which they would be answered, but when they were, that they would request a closed session of this committee to discuss responses.
I know many of us have received concerns and questions from members of the general public, members of the activist and advocacy community, and we're still in the process of sort of, I think, still processing that, as well as waiting for a response to those original set of questions. And in recognition of that and the alarming things that have taken place since our last set of questions, and additional questions that have arisen from the events that have taken place over the last week. I think that best course of action for this committee would be to coordinate additional questions from this committee that we have and formally present them as an addendum to the set of questions, and then move through this and in scheduling an additional hearing as we are able to schedule perhaps next week. I'd like any member of the committee that has an objection to that or would suggest another course of action. I invite you to speak up at this time.
Chairwoman Spencer, I don't have an objection at all. I just wanted to say on the record quickly, it's concerning to me that we haven't received any responses to date from the Department of Public Safety. While I realize that there are some pieces of information that may be more cumbersome in order to provide information on, generally speaking, most of the questions I asked seemingly would be documents or responses that could come quickly. Public Safety Director Jimmy Edwards indicated that it would not be a long and drawn out process. You know, he would not require us to submit a sunshine request. And so I am concerned that it's taking so long, and I because of the number of public inquiries and then those from the activist and advocacy community continue to pour in. I would really encourage the city to do the right thing and get us those answers sooner rather than later.
Alderwoman Negrassi, I appreciate those comments, and I join you in serious concern about that. I do want to be, while being mindful that there are emergency level issues going on, I do, however, continue to recognize that there should be, that information should be easy to share, some of it anyway, and from an administrative perspective. So I'd like to follow up with this committee via email and sharing concerns that we can addendum to the initial request, Alderwoman Negrassi, in light of some of the events that just took place. I think we all share in real horror, understanding, where we are and what appears to have taken place. So, and with that, I think we can coordinate that over email, maybe with a deadline by the end of this week, so we can get communication to Commissioner Glass before the weekend and additional concerns. Okay. With that, I think we have covered our issues on the agenda. I want to thank everybody for hanging in there for 2 hours, especially those who joined us who are not on the committee. This is an incredibly important issue, and remind everybody that, this is the first time we're experiencing this. And I'm really grateful for the commitment that you all have to serving the public that elected us and asking questions and digging into the real details to make sure that we're doing our due diligence of addressing concerns of equity when it comes to distributing the vaccine, and making sure that we are doing our jobs as policymakers to ask the tough questions and represent well the best interests of our citizens. I know we still have the issue of excused alderpersons, and I'd like to recognize Alderwoman Tyus in an excused absence. Vice Chair Navarro, did you have an issue that you wanted to raise before moving on through the agenda?
I just did want to mention that I did reach out to Chairman Glass and Director Edward to let them know that we were meeting today, and if they wanted to join us to share anything, that they were welcome to do so. They both got back to me right away and said that this time wasn't going to work for them. And I know we didn't have a chance to work with their schedules on this particular topic because we were coordinating with the representatives of the state on the timing of this meeting. So I just wanted to recognize that they did get back to me right away and said that they would not be able to participate today, but but they know that we'll be following up with them.
Alderwoman Navarro, thank you so much for reaching out to them. I'm glad that we were able to invite them and recognize that they were not able to attend, but I think this really does call for continued dialogue. I think we all recognize that, and we're all committed to continuing to dig into this issue, a very obviously very important one. With that, we have dispensed of the item number 7. We have no announcements, and with that, I'll entertain a motion to adjourn.
Move to adjourn.
Hearing no objections. Hearing no objections, that calls the Health and Human Services Committee. Thank you so much.
Thank you.